Welcome to the Pharma Sales and Tech Podcast. Tune in to stay informed, inspired, and connected with the world of pharma sales.
Hello, ladies and gentlemen. My name is Stefan, and I'm here with the Pharma Sales and Tech Podcast. And we have a wonderful guest here. His name is James Harper, and the company is 28B. A very interesting name for the company. But I think the best is if James makes his own intro. James, welcome.
Hi, thank you, Stefan, and thank you for having me on the podcast. Yeah, my name's James Harper. I founded 28B, 13 years ago. Originally, we were helping agencies deliver better on digital. And then 8 years ago, we came across CRM CLM development, and I'm an ex-rep. I was a rep for many years in the field, but I'm old enough to have used carbon copy paper to record calls and pop it in the mailbox. The most digital we got was an Excel spreadsheet. So to have seen how, what was available to field teams now with these amazing platforms for customer relationship management and the closed loop marketing aspect, I was excited enough by the opportunity to refocus the whole company. And now all that we focus on is enabling and empowering the orchestrator rep to create great customer experiences. And I believe that comes from the platform, from the content, and from the data that's provided, as long as you present that data in a meaningful and actionable way to those reps.
Awesome. Okay. I'm going to ask you, so I went through your LinkedIn profile, and one thing that stood out is your featured post, which is what the F is Omnichannel. Okay, can you, if I was a dog, could you explain me, I was a dog, a puppy, could you explain me what is Omnichannel in Pharma?
Well, Omnichannel originally came out of making sure that you finished your purchase transaction, right? So original Omnichannel was a very technical solution to ensure that if you were at your desk and filling in your Amazon basket with goodies to buy, and then you had to rush off and catch a train, that you could open your app on your phone and your basket would have the same items in and you could complete your transaction. So like way back in the day, Omnichannel was all about keeping that consistent experience around purchase. It's expanded now into customer experience. And that's where I think it runs for pharma. The Omnichannel is an opportunity, regardless of channel, function, or role, to create a great experience across all of those with an HCP. So for me, it boils down, and I don't like the term Omnichannel. I prefer customer experience. It's our job in pharma to create great customer experience for our customers so that they can increase their appropriate prescribing of our medicines. Or if you're in field medical, great experiences for your stakeholders, your HCPs, so that you're creating an environment in which appropriate prescribing can happen. And what does that look like? Well, it looks like a shared CRM between function, and so that's even between medical and marketing, in my view, with the right rules in place, but a shared CRM so that we've got insights onto our customers so that we can create that experience over time. What we're very poor at in this industry is creating experience over time. We tend to focus on the moment, a single engagement, etc. What we should be moving towards is a consistent and high value conversation over time.
Okay, let's think about worst case scenarios, how it is done, the experience over time, and best case scenarios. Maybe because you're a consultant, you've seen like a lot of good and bad cases. Let's discuss those. I mean, you don't need to disclose the company and stuff, but I would love to see.
Okay. So the good cases are rare to come across. So, we've been doing this for 8 years, focused on this space. We've got 17 pharma clients on our books, 14 agencies that we partner with. So we have a very broad view of what's going on. And I'm afraid there's a shortage of really good examples of that. And I'll even go so far as to say, I lead the digital interest group for the PM Society here in the UK. That's the Pharmaceutical Marketing Society. Also a judge, and we get to see the submissions for the Omnichannel or customer experience category. And we should be flooded with examples. We should be absolutely flooded with examples. And whilst there are some good examples in there, which I can't talk about, there's not as many as I'd like to see. So let's talk about worst case. And I won't even use a pharma industry example, but I'll draw a parallel with this. So first thing to bear in mind is we're not always competing with other medicines or other brands or other pharma companies. We're actually nowadays competing with a doctor's last best experience with other industries. Yeah. So, and when we look at how far in advance other industries are, we should be a little ashamed of where we're at. And yes, we're highly regulated. Yes, there's things that get in the way of this, but actually if you gave, enough space, enough time, and everyone said, yes, we could achieve this in a matter of months. So here's an example of a condensed version of what Pharma does. When's the last time that you phoned your insurance company or your mobile phone provider or whoever it might be? You've got a problem and you phone their support line. And the first thing that support line says is, can you input your account number digitally? So on your keypad, you put in your account number or whatever it might be. And then you hang around waiting and waiting and waiting and waiting. And eventually you get through to the call center. And what's the first thing they ask you to do? What's your account number? And you're a bit like, well, why did I put it in if you're then asking me for it? But anyway, you say that, and then they say, okay, how can I help you today? Obviously, been through security, and they'll take all your details and they'll take the problem, and then they go, oh, well, actually, you're through to the wrong department. I can't help you. I need to transfer you to another department. Frustrating. You go through to the next department, and the next department says, hi, can I have your account number? And you're like, but hang on. So I put this in digitally. I even heard your colleague tapping away, which means it's in the system. Why can't you see it? Maybe it's a security check. I don't know, but probably not. And then they say, okay, what's your problem? And you go, well, okay, so in the same annoying 1 hour phone call in which I've only actually talked for a few minutes, I've had to give my account number 3 times. I've had to give you the problem twice. One of you couldn't help me, and the next one's in the system, right? So in that's like a micro version of what we do with our consultants and our HCPs over time, which is the rep is having a staccato conversation with them because often they're not even allowed to keep call notes so that they can create a call continuum. You've got head office sending them untargeted emails that, don't gel with what the rep is communicating with them. And then you've got medical who feel they can't even communicate with commercial in some cases, having another conversation with that doctor. So over time, we're creating that same experience. The doctor doesn't feel valued. The doctor doesn't feel like we understand them. And it's difficult for us to address their needs across function, across channel in a meaningful way.
Okay, how can you do that? Like we were talking about the worst examples. Is there any good example you can actually share?
Not really. I've seen really good examples in a small way. So where I've seen good examples is for events and large conferences. So large international conferences where there's pre-engagement on social, direct outreach, and then an experience during the event, whether that's on stand or around. And we've seen multi-channel where you've got appropriate advertising that reaches out both to the doctor. So I've seen it where it's been on tube stations in the city where the thing's being held, and it leads the customer into an experience or the HCP into an experience. They have an experience on the stands. They have an experience with the team there. And it is creating that over time. But it's very focused on this one event and all the rest of it. And what I haven't seen from those, although they've been really impressive, is what happens next. And I'd be prepared to lay money that all of that good work done evaporates at the end of the event. And I would lay money that the interactions with those customers during that conference, that international conference, haven't been passed on to their local rep to follow on with. They might know their customer attended, but did they know what conversations they had? Did they know what materials were shared with them? Did they know how many times they were on the stand? Do they know what questions were asked during a session? So it's probably just evaporating at that end point. And the reason they can do it there is because you've got a clear focus, you've got parameters, you've got boundaries. There's an event you can do it, but our challenge is how do you extend that right around the customer rather than the event?
Yeah. So my experience with pharma events, so I come from the software as a service world, right? And the world where things are way more advanced than pharma. And like I'm seeing these pharma events being very sort of like like I would call them the low tech. Like all the pharma organizers are doing, they're just gathering people in a room and that's it. And then they're like, okay, set up your own meetings and everything, right? So they don't have. I haven't seen any like sort of like pre-events, like communities, anything like that we know, sort of like that we can learn from each other past the event. All you can see is like, okay, we have these recordings and that's it. So they're like pharma, like, what I'm seeing is that there is a lack of, I would say, learn from each other, like sort of group learning that essentially events should work on, should sort of like give you this like consistent flow of information that they could actually give you. The newsletters through like cool, useful social media, So that's why like I see a lack of like useful information in pharma. So that's why we actually started this podcast because we wanted to learn. So how do sales reps learn in pharma, right? How do they learn to use it? Yeah.
So you're talking about the silos, right?
Yes.
So
Correct. Yes. Yeah.
And so we love a good silo in pharma. Um, we and it's not even between companies. Now, you can understand the difficulty of companies coming together to collaborate, especially when they're competitive. But even within a company, we've got the silo between medical and commercial. And then within commercial, we've got a silo between marketing and sales. And if we want to create a customer experience, the customer doesn't care really who they're talking to in that journey. They don't fully really understand the difference between an MSL and a rep and the regulations, because those regulations, they're a little obscure, they're a little mystical in a way to the doctor, and really understanding that. They just want their needs met by the most appropriate person. And they want those needs, if they are met, not to be repeated in the future or not to be ignored in the future. So those silos need to be broken down. In terms of what you're talking about, best practice, that's why we started the Digital Pharma Unlock community. We've got 890 people as part of that community. And it's the meetings that we run there are free-form, non-presentation based, and open and honest, right? So we say deliberately daring, deliberately honest, and deliberately free, because often the big events, and quite rightly, are very well orchestrated, like, the Reuters events, because people pay a lot of money to go to those. So they expect something. But when you look at the presentations given, they're very curated and they're very careful. I prefer this sort of discussion that we're having, Stefan, where we can be a bit more honest and a bit more challenging. So how do we break down those barriers? There's two ways. One is more meetings like that, more discussion, more open and more honesty, because if we collaborate better as companies, then the customer will have better experiences. The other way is, as part of the PM Society and the Digital Interest Group, we are running cross-company supper clubs where we'll bring together digital leads or customer engagement excellence leads from different competitive companies, where they can have a discussion about the challenges they see in their role or the opportunities they see for the industry to improve for our customers. And hopefully can do that sort of kind of a bit behind closed doors. But what we're intending to do is to write a report out of that so that more people can benefit. And I think there needs to be more of that. There needs to be more of that roundtable discussion about how we as an industry can improve. And that's where bodies like the Pharmaceutical Marketing Society, the Healthcare Communications Association in the UK can do that sort of thing and represent both agency and industry as a whole, rather than individual pharma companies and their commercial goals.
Yeah, correct. So like what I'm saying, that you guys are doing a great thing. And if you accept, I'll be a member of your group.
Please, if you're over in the UK in August, I think August the 16th, we're going to have a big social. So no talks, no presentations, nothing boring, just a free bar, something to eat, and a good networking opportunity. So that'll go out to the community, which is on Meetup. You can just join us on the Meetup app. Just search for Digital Pharma Unlocked and we'll pop up.
I've had both teams on the podcast, and I had a few guys from
okay.
there. Yeah, so like again, this podcast is that the goal is like to get the information out there from the closed pharma society that has actually a bad rep, because I think pharma people are cool. It's just that it has a bad rep in the everywhere, that like pharma, they're just so close, they don't share information, and that's the problem. That like I'm seeing people, you don't have market researchers, like you don't have legit market researchers about like ways to how to work the omnichannel, like case studies, like, okay, this is what we did, so people don't learn from each other. And then the result, you have bad experiences for people and, customers. And as you mentioned, customers don't really care. Are they talking to a CSM, like customer success manager? Are they talking to an account manager or to marketing? Or are they talking to like someone in sales, right? All they care is the experience. And they will always remember the last experience they had with your company, right? With your product. And it's very important to give, even though you've delivered within the past maybe 6 years or 7 years, they will always remember the last one. It was bad, then they'll remember it about company. So maybe you won't be able to increase your prescription sales with that HCP anymore, right?
I was just going to agree with you that a good example is you can have a great holiday, but if you have a delayed flight back or you get ill on the last day, then that's kind of what you remember, right? And in agency, you say you're only as good as your last project. Well, it's the same with pharma. You're only as well perceived as your last interaction. So we work so hard to create an interaction with a customer, whether that be digital or in person. And yet we seem not to really be able to measure the value of that interaction appropriately, because omnichannel and creating great customer experiences, you can build up to it and you can create the great content. You can train your reps better to access the right content and the right insights. And then the interaction happens, whether that's digital or in person. Like any closed loop, omnichannel, digital solution, we're all about evaluation, right? So we're all about evaluation, iteration, and improvement. But if we can't measure the impact that that interaction is having for the customer, then how do we improve? And actually, I'll be honest, that one's the real challenge right now, is how do we measure value? How do we measure impact? And how do we see that improving over time?
I have a friend who is a company, they are doing net promoter score surveys. So after any experience with the client, you basically get a survey where you can sort of score how was your experience and like a rating. And this is huge in a lot of industries. I haven't seen anything like that in pharma yet. And it's a very simple thing.
There's a fair few. So we're aware of a pharma client that's shifted their incentivization for field teams away from sales towards NPS. Not fully away from sales, still there, but net promoter score. You've got CSAT, customer satisfaction. The problem with those, to a degree, they're not the silver bullet, right? Because customer satisfaction, and we have to be careful here. If we move too far away from sales and we forget that that's what we do, we sell drugs. You've got to believe that the drug that you're selling will, for the right patient, improve outcomes. If you believe that, then your passion should be for getting more of it used in those patients. And that means sales. That's the social contract between you and a customer, an HCP, is they're seeing you because they want to be persuaded that your drug will benefit their patients. That's the interaction, right? But if we measure value and we focus too much on value without the sales aspect, is if I'm seeing a doctor and I run lunchtime meetings and I bring the best sandwiches, but I don't happen to sell very well, or I don't happen to educate very well, but I bring M&S, which in the UK is the posh sandwiches, instead of the cheap supermarket sandwiches, do I get a better NPS score? So, we're going to be careful about what we're measuring, what you ask for, what you get, that sort of thing. But, there has to be a combination, in my view, of NPS and CSAT. But obviously the lag indicators are what we're really interested in. But that's the challenge in pharma. Sales and patient outcomes are the ultimate lag indicators. What do we use in between that to measure impact? And if we move too far into the value and service provision and too far away from sales, I think we're doing a disservice to both the commercial organization and the customers, because in essence, they're wanting to be sold to. And just to expand on that, and I get a lot of challenges on this, is, people don't like being sold to. Well, it's true. If I get a cold call for, I don't know, pet insurance and I don't have a pet, I don't want that call, right? I'm not interested. But if I'm in the market for a new car, oh yeah, sell it to me, baby, right? Get me excited about that car. How fast does it go? Like, what are my extras? I get really yes, because I'm in the market for that. And clinicians, if they're struggling to treat patients effectively, are in the market for a better treatment. And they do want to be told about where the benefits are, etc. Regardless of self-reporting surveys about how they're influenced only by BMJ articles and only by peers, they are also influenced strongly, in my view, by a well-informed, scientifically literate rep.
Great. So like what I was saying, that you have to somehow dissect the experience you're getting from sales, the sales skill of over the product, right? The product can be very good, but the sales rep can do a very bad job like selling it, right? And you as a sales rep, experienced sales rep, you know that, right?
Yeah, I'd even say in certain circumstances, I wasn't a very good rep. Come on. I'll have had bad days. I'll have got out the wrong side of the bed. To sell effectively every single time, we're not robots and all the rest of it, but there are also some terrible reps out there, and there's some exceptional reps out there. Just like there's some terrible MSLs out there, and there's some exceptional MSLs out there. There's some exceptional business owners like me. No, I shouldn't have said exceptional. I meant business owners like me. There can be exceptional ones, and there can be terrible ones, right? We're human beings and all the rest of it. So yeah, I guess what we can do is we can talk about how, a platform like Platforce or whatever it might be can help the bottom quartile reps, right? The reps that struggle. Technology and data and insights on customers can help them be better. The best rep out there could sell off the back of a cigarette packet and, with their hands tied behind their back. But they're the exception, right? The average rep or the rep that's struggling or the new rep, we can elevate their performance significantly with great content and great data. And that content and data is delivered via the platforms, like I say, like Platforce, like OCE, like Viva. They are, if used correctly, a hugely beneficial thing for reps selling effectiveness wise.
How important would you say would be education, like educating a sales rep about the capabilities of a platform such as like Vivo or like Platforce or let's say IQVIA? How important is that when you make like how important is that whether you like when you're preparing your rep for success? Would you say? Would you say?
It's more important than the platform itself. I know that sounds odd if you're going to train them on the platform, but as technologists and as an industry, and I think people in general jump to tool set. I think the idea of something new or something improved can solve all our problems in one go. So we think at 28B in terms of mindset, skill set, tool set. So tool set is the platform or the content or the data. And what we've done as an industry historically and continue to do is, hey guys, here's this cool new tool set. Off you go. Get it done, right? Maybe with some limited training. And that's the skill set bit. And actually, to be fair, we're pretty good at the skill set bit in general. I think we could do much, much better on the technology front. But in terms of the scientific and the therapy area and the disease and the product itself, we're really good at the skill set.
Okay.
Mindset, the mindset is key because if you haven't done that first, then the learning is harder or ineffective. And if I haven't got the mindset, then I'm not even bought into the idea of using the tool set. And that's what we see almost everywhere. If you roll back and think about from the days of Siebel through to Viva and MI Touch and whatever it might have been back in the day, they were almost all launched. Well, not almost, they were all launched as field compliance tools. They were launched to monitor reps in their call rate, their reach, their frequency, both to see if they're doing the job they're paid to do, although that's a vanity metric and I'd argue against those, but also to ensure we weren't over calling on doctors or even under calling on them, right? So most field teams of an age see Viva and OCE and was MI Touch and those platforms predominantly as something they have to use to show they're doing their job. That's it. And you can see it in the quality of the call reports and the quality of the interaction that they're just basically, I'm told I need to do it, so I'm going to do it. If you look at what the technology does, if you look at what Platforce will deliver or what OCE will deliver or Viva will deliver, and you just take field compliance out of it, ignore that bit for a minute, and talk about how it can capture data and information on customers that derives insights that can allow the rep to deliver content regardless of channel across multiple channels and create that experience and it be what it really truly is, which is a customer relationship management tool with closed loop marketing abilities. Why every rep should be desperate to use it, should be challenging themselves as to what more they can do with that platform. But that's a mindset shift. We haven't told them that yet in most cases. We haven't raised their aspiration to show, just look what you can do with it. It will help you sell more, get home earlier, be the top 10 rep, right? You know, whatever that bonus might be, you can get it if you use the system right. That's what the mindset bit is. If we get that bit right and they're on board with it, then the skill set will follow. And once the skill set's in place, then that tool set will come alive and we can unlock that full potential of these platforms, which at the moment, it's no more than 10 to 20% of what that platform can do is being used in the field. And another good example of that is Viva's Pulse data from April this year showed that 77% of the content that's created for a field team is rarely or never used. 77%. So we haven't even got the mindset right on that this content is good. It may be that the content isn't, but let's just assume it's pretty good, but the reps aren't using it or it's been missold to them or they haven't been trained on using it. There's this huge gap between what we're producing and what they're using. And if you marry that with the data that shows if you do use it, there's a 2.5 times increase in the number of patient starts, we need to close that gap, right? And for me, mindset is absolutely, absolutely critical in that, followed by skill set and then the tool set.
That's correct. You know, I think that the problem is in people actually, like trying to sell people or trying to like the reps in pharma, they're used to like, as if they still once and they don't know, like, so in marketing, I do marketing and sales. In marketing, there is this concept called lead nurturing or like prospect nurturing. When you don't focus just on one, like this first approach, you send them a few messages, one follow up, and then you forget about the person, right? They might be in the market to buy, right? As you said with the car, in example with the car, right now. But if you continue like nurturing them in the future, you'll eventually hit the point, when they'll be interested in your product. And I think so the specific of pharma is that salespeople are also marketers in pharma because it's similar to the nature of the business. So they have to also learn the basics of like nurturing people and not just sending them like, are you ready to buy? Have you seen the prospect? That sort of messages, but also educate. And I think that educating the sales reps so they could educate the HCPs and the doctors is the bigger piece of the cake that we're sort of missing as an industry, maybe as a whole. What do you think?
I'm not sure I agree. I think your average rep is very much aware of the sales process that they're trained in and the call continuum, which is developing that customer over time. We talk a lot about adoption ladder, naive, trial user, regular user, champion, etc. And within the CRM, you've got those adoption ladder things. And I think the aspiration is there and the knowledge is there, but I'm not sure we empower and enable that. And in fact, I'd go further and say we actually hamstring, we actually create problems for our field teams. Most pharma companies now do not allow the field teams to take field notes in their CRM for fear of pharmacovigilance in the US and GDPR in the EU. And that, frankly, is insane. I don't see, we're not supposed to see doctors without requests more than, I can't even remember now, 3 to 4 times a year. So that's every 3-4 months. How am I supposed to remember the conversation I had with that customer if I haven't got notes somewhere? And the good reps, they'll keep those notes. They'll be in an Excel spreadsheet. They'll be written down somewhere. So they're still being captured. But this ridiculous lack of trust in that rep to take the right notes. When we trust them to verbalize and sell for that customer, we should trust them to take the right notes. And there's also, at least in Viva, and I'm sure many other platforms, the ability to monitor those notes and to look for things that would be concerning from a GDPR or pharmacovigilance point of view. So that's a fundamental for me. If you as an organization have stopped your reps from keeping call notes, pre-call planning, post-call notes, then how can you expect them to think like you were saying, Stefan, to create that experience over time and to move a customer along the adoption ladder? So we have to do crazy things. When we develop a sales aid for a customer, we're programmatically dropping content into those fields. So depending on which slides the customer's interacted with, depending on the questions that the reps asked, doctor, what's your number one treatment priority? We'll take those results and we'll push them as set text, depending on those interactions, into those fields in a hope to help the rep create that conversation over time. But they should be allowed to do freehand notes as well. They should be, they need to be specific to that doctor. So I feel, you can tell, I feel quite strongly that that's a ridiculousness that we've fallen into because people are not getting the risk benefit right between field notes and PV and GDPR concerns.
Yeah, my feeling is like, although you're gathering consent from the doctor that you can discuss a certain topic or a certain medicine, you still cannot gather field notes, which is like crazy. You already have the consent. What else do you need? Like, you need a second consent? You want to send them?
No, it's not. It's more about recording data to the system that's inappropriate or for not reporting a pharmacovigilance issue. So doctor said a patient had a headache, right? That immediately becomes a PV issue. And if you write that in the call notes and you don't submit it properly through the system, then that's an issue. But we trust reps to be out there and representing our brands. We should be able to trust them to take notes. And as I say, there are crawler technology out there that will look through notes and start to flag trends that are inappropriate and all the rest of it. So I think it's an educational issue. I think it's a mindset reset, but I certainly think we should trust our field teams to take the right notes. And on that journey planning, let's go back to Omnichannel for a second. It's really important to create persistent journeys. Yeah. So when we think about field teams out there, especially in the rarer diseases and oncology space, they've got fewer and fewer customers, but they're more and more important, right? Why can't we enable them through technology to create their own personal journey for that customer? And we've developed dashboards that fit within Viva and other platforms that allow the rep to create an individual journey for that customer based on the needs and the insights that they've gathered. Like, what email am I going to send them in this month? If I see them on this day, what am I going to follow up with? Which webinar should I invite them to based upon their needs? So, when a rep steps in front of a customer, the first thing they should be doing, apart from saying hi and creating some sort of meaningful empathy, sympathy, not sympathy, but, what am I trying to say? Make a connection, right? The first thing you do is you make a connection with an individual. Once you've done that, you're really talking about, in sales term, what you call source of business. right? What disease, what patient, what treatment challenges, and what are you unhappy with your current treatment? Those are essentially my source of business as a rep. So what disease, what type of patient within that, what that patient or what the treatment challenges are, and then where you're unsatisfied. If you think about the results of that, or at least of the last three, that's really, really powerful stuff for an omnichannel perspective. So if I was speaking to Dr. Stefan, I say, Stefan, when it comes to treating patients with asthma, what's the one challenge that keeps you up at night? And you might reply, well, to be honest, it's patients who don't know how to use their inhalers. It's their, what's the phrase there? Their adherence to, or their techniques in using the inhalers, because however much I prescribe, if they use them wrong, it's not going to work. That's really interesting. And how many patients like that do you see a month? I don't know, 5, 10. Okay. So when you think about that patient, when they walk through the door, like what's the first thing you think about? What's the first priority? Well, it's going to be the adherence and administration, right? So when you capture that to the CRM, which you can do by writing that from the sales aid where you've been asking those questions, and you write that to the CRM, the head office marketing team, when they're looking at their omnichannel outreach and they're looking at engaging people on an email campaign or inviting them to a webinar, if that webinar is on patient inhaler technique, then they should be picking on all those customers that listed that as their number one problem, rather than sending it to every single customer in the hope that some of them are kept up at night by poor inhaler technique with their patients. And I'd even go so far as to challenge any brand team. Can they be 100% sure that they've not sent an email to a customer saying, you should look at this clinical study, or you should look at this tool we've developed, and that the author of that study or that tool hasn't received that email saying, hey, if you're struggling with, look at this, right? And because we don't have good data on our customers, we are shotgunning stuff out there that in some cases will undermine a relationship. So how does that KOL feel that they're perceived by that company when that company just sent them an email saying, hey, struggling with poor inhaler technique? Look at this tool for inhaler technique. And he was the author of that tool. It's not cool, right?
Not very cool. I would say, yeah, that's the problem though. You get low email opening rates. You get bad CTR. People are like, ACPs are not interested in the content because the data is lacking. So, it's sort of like you cannot sequence a certain topic. So certain problem, let's say the inhalator problem, to just those who actually need it, right? So you're blasting it to everyone who needs it, who doesn't need it. And eventually they end up not opening your emails, and then you lack on, you're not top of mind and you cannot sell more prescriptions, right? Because you're not there in the decision. You're not in the market when your customers are in the market because they're not paying attention, right? Attention game at the end of the day.
Yeah. In really simple terms, take it back to what I said earlier. If I get a cold call about, not that you would get a cold call about a car, buying a car, but I've just bought one or I can't afford it, right? I'm not going to take the call. But if I'm literally thinking about buying a car, which is why Facebook advertising and Amazon, and that's why they spend so much money on understanding you and targeting ads and targeting engagement. We can't even do that in pharma with field teams, with human beings, because we don't collect enough data and we don't use that data wisely. Obviously we need to be sensitive and how we gather and how we use that data. But the fact is that all of us, well, almost all of us, allow Google and Facebook and other things to collect data on us because it enhances our experience with that platform. Going to your Amazon homepage, it is, however you want to look at it, it's targeting me with the stuff that I like. And it is tempting me to buy and like the rest of it. So it's not, we shouldn't be shy of that with our customers. If we don't understand their needs and we don't target our educational offerings or our sales offerings to their needs, then we're failing. We need to create that engagement and that experience.
James, I think I could talk to you for hours, but I don't want to make this podcast like hours long. And I think I'd like to invite you for another talk, maybe half a year later. But my question is, if you could give some advice to pharma companies, and like maybe if sales excellence leads, what would that advice sound like?
Gosh, as you can probably tell, I've got lots of advice to give. Everything from, and I'm stealing this from Chris Mann at Amgen. At the end of our WTF is Omnichannel, I asked the same thing of my panelists, and Chris Mann from Amgen said, share every success, however small. And I think that's important. You asked me earlier in the podcast, have you got examples of best practice? And it's really hard to find an example of true omnichannel, because true omnichannel should be right across the organization, regardless of function, regardless of brand, it's a big thing, and it's quite a big thing to achieve. But like I said, if you take it down to an individual event or a conference where you have created in a microcosm a great experience with your customers, that should be shared internally. So that's one, is share everything. But before you get there, there's two other things I'd talk about. One is define what you mean by omnichannel.
Okay.
So even within the same company or even the same team within that company, we hear different definitions, different agreements about what omnichannel is. So what are you setting out to do? Get everyone on board with that. And I hope that that definition, that ambition, that goal includes the words customer experience, right? Or engagement or something in that space. So define what it is you're going, because you can't get behind something if you don't have a vision and a mission for it. And then I also say start small. And what I mean by that is, yes, AI has a huge amount to offer. It's an incredible technology and it helps us crunch huge data sets and to show insights and trends. But not even using the most basic data. We're not even capturing the most basic data generated by our field team. So we talk about that at 28B when we do mindset, skill set work, is your brilliant basics. If you've got a rep on territory, seeing customers, make sure you're capturing what you can from those interactions, not how many slides were shown to what doctor, but what are their treatment challenges? How many patients do they see? What does keep them up at night? Those core things that we capture, A, help the rep sell better in the moment, but B, help us provide through omnichannel, through that omnichannel approach, a much more meaningful engagement over time with that customer. So make sure you're capturing the right data, make sure you've got a definition for where you're going, and then share every success, however small.
Yes. That's what we're doing at Platforce. We're recording all the successes.
Yep.
And we're actually,
Yep.
we don't have failures. We have learning. So we're teaching people about our learnings as well. That's okay. So
great fan of making sure failure is not seen as is not hidden away. I had a failed business in the past. I started a business many years ago. It didn't work, but I learned a huge amount from it. And I wouldn't be successful like I am today if I hadn't had that failure. So failures are learning opportunities. Absolutely.
That's for sure. You learn more from failure than from success, right?
Success can blind you and you get complacent.
Cool. James, thank you so much for the episode. I was thinking, where could our podcast listeners reach out or like find you online?
Just LinkedIn. LinkedIn's the only social I use. So just find me on LinkedIn, James Harper, 28B. And that's where I post. We're very free with a lot of our resources and insights because I'm really keen for the industry to improve. So there's always good stuff coming out on that. And of course, just Google 28B and Viva or 28B and Platforce or 28B and OCE and it'll come up.
Awesome. Thank you so much, James. Have a good one.
Thank you, sir. Really enjoyed it. Cheers. Bye-bye.